Hello, and welcome to a Swift View on Health. My name is Scott Shainvogel, and today I want to talk to you about a phenomenon that was recently written about how rising healthcare costs are creating job lock. Basically, people are unwilling to leave their jobs in America right now. So, 1 in 5 workers say they want to leave their jobs, but they won't solely to protect their healthcare coverage. Now, that's just the people that want to leave. I would argue that there are many more people that are actually okay with their job, but one of the reasons that they're staying is simply for benefits. So even though 20% are saying they're only staying for benefits, I think benefits probably right now is one of the main reasons people want to keep their current job positions. You can see that 48% fear this lack of coverage or potential loss because it's just so expensive. The average family premium right now is $23,000, and depending what market you're in, it could be even more. So this was a recent kind of Gallup West Health survey. Really interesting dynamic where a number of years ago, I think as many of you remember, people were trading jobs all the time. There wasn't a lot of loyalty or retention, and healthcare is actually starting to change some of those dynamics in the job market today. Um, you know, Individuals now understand that there's not really a comparable alternative to employer-sponsored healthcare. If you've tried to go into the individual market lately, you're going to find super high out-of-pocket costs, really limited coverage options, and a lack of access to many different providers. And so that's a real challenge and not the healthcare solution that most of us want or have come to expect in our lives. And, for employers right now, while they're seeing this retention dynamic change and loyalty start to increase due to healthcare coverage, there are, and that might be perceived as a positive, there are some things that they really need to be ahead of when it comes to healthcare. And that is the fact that, the reason that healthcare coverage, is becoming such a compelling reason to stay is not only that there are no other good options, but many of those options now are creating additional costs for the rest of the market and particularly for employers. Really employer-sponsored healthcare with cuts in Medicaid, cuts in Medicare, kind of deteriorating coverage on the affordable care market, like all that is decreasing the amount of revenue that's coming into health plans and health providers from those other healthcare coverage categories, which is putting more pressure on those providers to try to get additional dollars out of the employer sponsored healthcare coverage marketplace, which is a tremendous amount of cost risk for employers and something that they need to do everything they can to get ahead of. And so, with this moment, I think one of the, whenever there's a kind of a challenge, or an issue, it often creates an opportunity at the same time. And, here at Swift, we're somewhat excited about this just because, there are a lot of very innovative health plan strategies and designs out there that might require more change in your culture, in your current healthcare dynamic at your employer. But, the tolerance for that change is probably higher than it's been in a long time. And this is really an opportunity, whether it's going self-funded, looking at advanced primary care and a lot of the direct care strategies that we've talked about, kind of reframing how we're going to access the healthcare system, the providers that we're going to start with to get the best quality and the best care. Like these are all opportunities now to implement some of these very impactful strategies uh, in a manner that, once again, has uh, a much more limited impact on your workforce, and allows us to innovate in a way that we haven't been able to in a very long time. So, a lot of challenges in the healthcare marketplace. However, some of those challenges are really creating the platform for employer innovation and change. And we're excited to be a part of that journey. So, thank you so much for listening to this week's episode of A Swift View on Health. And as always, I want to encourage you to stay smart about the challenges in healthcare and be swift.